I'm Dr. Neil Fine. I'm a plastic surgeon in Chicago, and I'm here to discuss an important new paper on breast reconstruction. Breast reconstruction in the U.S. is primarily performed as a two-step expander-to-implant reconstruction. The tissue expander is a type of implant that's adjustable, and it can be put in at a smaller size, allowing the skin time to recover from the mastectomy. It can then be adjusted into whatever size the woman desires or her skin would allow. After that process has happened, that expander can be removed and the more permanent implant placed. That's a traditional two-stage tissue expander reconstruction. The study that we have before us is talking about a new process where we can skip the tissue expander and go to an immediate implant. This is sometimes referred to as single stage, single step, or direct-to-implant reconstruction. This is an important new advance in the field of breast reconstruction. This is a new choice for women and is something that should be examined closely. This study has shown that in a selected group of a relatively limited number of women, this can be done successfully and with an acceptable outcome. However, it should be noted that the group of women who had direct-to-implant was a much smaller group than the two-stage reconstruction. It should also be noted that they were more commonly having a prophylactic or risk-reducing mastectomy, which often does not cause as much stress on the skin as a cancer-removing mastectomy. It should also be noted that these women were selected for this beforehand based on their characteristics and their surgeon's understanding of their desires and their surgeon's capabilities. Most commonly, that will mean this is a woman who has a relatively smaller to medium-sized breast, and she wants to stay that way, to stay a smaller to medium size and or become smaller than she is at that time. This is rarely applicable to a woman who would like to increase her breast size. Therefore, the take-home point for me after this study is to say, this is an important new advance. It's a new choice. More information and more choice is good in many ways, and certainly in breast reconstruction. However, for the majority of women who are undergoing a mastectomy, especially if they're undergoing a mastectomy for cancer, or they have some concern over their final size that they want to be, they will find that sticking with the traditional two-step expander to implant process will lead to a more optimal, more predictable result for them. Thank you.